I want to introduce Clayton Lane, who is our moderator. Hi, Clayton. Good to see you. And Clayton is the chair of the board of the Shared Use Mobility Center. And he has over 20 years experience as a social entrepreneur, mobility expert, international executive. And I met Clayton when he was a car share operator. So he was the founder of Philly Car Share, and I was started with iGo car sharing here in Chicago. And so all us car share operators, we used to meet and connect and help build our nonprofit social ventures. So, then Clayton went on to work in all kinds of international organizations, Burke, World Resources Institute, he ran IDTE, and now he's got another thing, international business development at Ascendal and Go Metro. So anyway, with that, I'm gonna turn it over to Clayton, and he will introduce the plenary panel. And I just want all of you to know we're running a little behind, and we'll just go 15 minutes over into the expo time. So, so this session will go 15 minutes longer than was on your agenda. Thank you.
Thank you, Sharon, and to the fantastic team for making this happen, and all the participants here. Also to Gia for, I think, the very inspiring message about bending our work toward justice and the value of collaboration. I think it segues perfectly into the experiences we'll hear today from cities around this country and thought leaders. Today, we are talking with professionals working on the front lines of shared mobility during this pandemic, whether operating a public transit agency or shared mobility company, shaping public policy, or just keeping close tabs on the industry and its players. And today we get to learn their experience and their outlook for the future. How is COVID-19 impacting shared mobility right now and in the near term? What short-term strategies and tactics should we implement during the recovery period to ensure equitable, safe, accessible, and environmentally sound transportation? Cities are moving, and we are seeing resilience in action. Before I introduce the panelists, I'd like to share 3 quick examples of how cities are responding proactively to this crisis around the world. I work for 2 international companies Sharon mentioned, Go Metro, which is a mobility technology and planning firm based in South Africa, and Ascendal, based in the UK, an innovative public transport operator. And together, these 2 firms have combined their technology, their operations experience, in a special initiative to support several cities. In Buenos Aires, the city there has enlisted our support to quickly develop a resilient bus network to connect essential workers and transit-dependent households to their jobs and literally keep society functioning. Buenos Aires is about the size of Chicago and trying to respond very quickly. A second example comes from Cape Town, South Africa. In partnership with the Max Planck Institute, we've developed a MatSim travel model to simulate COVID-19 transmissions. And so that model uses agent-based simulations to produce contact networks via the mobility system and to rapidly simulate how proposed lockdown policies would impact transit ridership and the spread of COVID-19. And so Cape Town is now using that travel model to design its social distancing policy and its transit system, something we never would have conceived of just 6 months ago. And then third, nearby in Austin, Texas, Capital Metro was in the middle of conducting 24,000 passenger intercept surveys on origins, destinations, perceptions, and attitudes when Austin canceled South by Southwest and shut down the city. And Capital Metro could have counted that intercept survey as a total loss, but instead now plans to conduct the balance of about 10,000 surveys just after the lockdown. So the agency will have the most immediate data possible on how passenger attitudes and travel patterns are changing in response to COVID-19 to inform its bus and rail service adjustments. So, these are 3 examples of resilience in the face of unprecedented challenges. And they're just the tip of the iceberg. It shows, I think, it shows the global breadth of this pandemic and how lessons that we learn today from San Francisco, Chicago, and other parts of the US could help influence better outcomes, even for cities around the world. So today, we get to hear from esteemed practitioners, operators, thought leaders in our space, working through this pandemic. So I'll introduce you now. We have Jeffrey Tumlin, Executive Director of San Francisco Municipal Transportation Authority. Jeff, welcome to your first 100 days on the job. Jeff is the former Director of Strategy at Nelson Nygaard Consulting. For more than 20 years, he's led station area, downtown, citywide, and campus plans, and he's delivered lectures and classes in 20 US states and 5 countries. His major development projects have won numerous awards for their environmental and mobility impacts. And Jeff is the author, this is perfect. He is the author of Sustainable Transportation, Tools for Creating Healthy, Vibrant, and Resilient Communities, published in 2012. The man literally wrote the book on resilience years ago, and now is in a very challenging position of having to implement that. Welcome, Jeff. We cannot wait to hear your story. Next, we're honored also to have Ron Burke, head of Micromobility at Lyft. Ron, for 9 years, was Executive Director of Active Transportation Alliance, the Chicago region's voice for better biking, walking, and public transportation. He's also held prominent roles in the Union of Concerned Scientists, the Illinois EPA, and the American Lung Association. Again, joining us today from Lyft. And as a sign of the time, we were expecting to welcome Lily Shoup, Policy Director at Lyft, but Lyft had a round of layoffs last week. Many of us know Lily and hold her in very high regard. And I'm sure that we will learn today about how this pandemic is affecting Lyft in a very real way. Next, from the policy and academic space, we have Beth Osborne and David Zipper. So Beth is Director of T4A, Transportation for America. She was previously at the US DOT since 2009, serving as acting assistant secretary for transportation policy. At DOT, Beth managed the Tiger Discretionary Grant Program, which so many of us love and know very well. Also, she managed the Secretary's Livability Initiative, the administration's Surface Transportation Authorization Proposal, and the implementation of MAP 21. Previously, Beth worked for Senator Tom Carper in Delaware as an advisor for transport, trade, and labor policy, and as the Policy Director for Smart Growth America. Welcome, Beth. We're so glad to have you. And finally, we have David Zipper. David is a visiting fellow at the Harvard Kennedy School's Taubman Center for State and Local Policy, or Government, where he focuses on the future of urban mobility and technology. You may know him from a number of publications. He recently coined the term the walled garden, referring to the data that private mobility companies want you to see. His writing has been published in The Atlantic, Slate, Car and Driver, Wired, and Fast Company, among others. David was previously Managing Director for Smart Cities and Mobility at 1776, a global venture capital and startup hub. He served also as Director of Business Development and Strategy under 2 mayors in Washington, DC, and holds esteemed degrees in MBA from Harvard, I wanted to mention, and Master of Philosophy from Cambridge, which I think kind of shows you the background and perspective that David brings. We are so glad to have all of you here today. I am expecting such a rich discussion, and I want to just get into it because we're so eager to hear your stories. So we'll just kick things off, really focused on the current crisis, what's happening right now. And I'd love our audience to hear from you. What is the biggest challenge that you are facing right now? How is this pandemic affecting your day-to-day service delivery or policy guidance? And how are your people feeling? Who'd like to start? I'm going to start in my upper left. I'm not sure who's in your upper left, and I see Jeff at the top. So Jeff, if you could start for us, we'll go from there.
There are so many challenges. One of the challenges is that we're continuing to lose $16 million a week, and keeping the lights on is going to be a challenge. But I think the biggest challenge that we're facing is an emotional challenge. It's fear. our workforce is exhausted and traumatized. And the traveling public, the essential workers that we're still trying to get to work every day, are afraid every time they use the mobility system. And this fear is the kind of fear, because this trauma is going to continue for months. This could completely change not only the way people see mobility, but the culture of cities. We have to be paying very careful attention to the emotional reality of the people in cities in order to have a positive recovery. I think that that is possible, but we need to distinguish between the health science of what we are doing to reduce the transmission of the virus and people's emotional experience, particularly the fear that they are enduring, and how we take care of people.
That is a very frank assessment and much appreciated. And Ron, as you are the other operator on our panel, I'd love to hear from you as well. How are things affecting your team, your service today? Ron might be muted, I'm not sure. That's you are muted, you were just saying something.
Bobby instead of Ron?
No,
What did you say, Sharon?
Oh,
Bobby is the captioner. We are emailing, reaching out to Ron right now.
Okay, very good. Well, good. Let's move to Beth and your experience. How are things going right now?
So we aren't an operator, so we're clearly not affected like Jeff's team is, and you know, Jeff as the leader of a transportation mobility provider. We have been working with transit agencies across the country to make sure that folks on Capitol Hill are aware of what is happening and what is needed to support them in the short term. We now need to work with them on what is needed in the long term. We're also working with cities who are trying to respond to the need to give people space to be socially distanced, but still be healthy and still be able to get to basic necessities like the grocery. What we do as an organization is try to collect the information from what communities are trying to do, what they're learning from their various attempts, and share them with other communities so that, you know, while we're all separated physically, we can still learn from one another, and everyone doesn't have to do things on their own. This is a time where folks do feel particularly alone, and so the extent to which organizations like mine can create some community by sharing information, that's something we want to do. And then, like I said, just to make sure that policymakers from the CDC to Congress to FTA understand what people on the ground are seeking from them.
That's great. And David, bringing a broader perspective to things. What are you seeing?
You can call me Zipper, that's fine. Won't be the first. No, I think Jeff and Beth spoke well. I would just be really brief. And again, I'm not an operator, but I talk to lots of operators across the country. And I have a lot of empathy for the situation, because basically everyone who is leading a DOT or a staff member at a DOT in a senior role or at a transit agency at the moment is being asked to both manage a crisis and plan for a future that's going to look totally different at the same time. And I think that's incredibly difficult to do. I think as far as I can tell, March and early April was almost entirely consumed by crisis management for most public leaders. And I think only now are people like myself, and I think Beth does this as well, trying to be able to offer some constructive ideas about where things might be headed and what sort of strategic moves might make sense. But it's an incredibly challenging situation for everyone in transportation, and to be honest, almost everybody in this country right now.
Absolutely, and I think you hit on something really important there. Managing a current crisis, but also trying to somehow plan for the future in a really quick way. Either one of those would be a huge task on its own. This is clearly a time when we all as a community are being presented with major challenges. But I want to highlight too, this is also a time when we're seeing some very, very significant responses to that as a community. And I wonder if the three of you could help us understand from your perspective, what that rising to the challenge has looked like in your space, in your part of our community.
I'm happy to jump in.
Okay.
Rising to the challenge back in early March started for Transportation for America, just reading the news about what was happening in terms of everyone being sent home. I remember reading an article in the Washington Post around March 9th or 10th saying that the Trump administration was considering having all of their agency staff work from home. And it occurred to me that in the past, when our transit agency, WMATA, has had to weather a government shutdown, it's been pretty devastating to them. And then it occurred to me that a full telecommuting requirement would actually be worse than our typical shutdown. And WMATA would be devastated. And then the next obvious thing was that Seattle Transit, which had already been in a community shutdown for some while, must be struggling greatly. And so we just started asking questions around, realized what an incredible hit this was going to be to transit agencies, and yet how essential transit was going to be to keeping our healthcare system, our supply chain system all running. And so when I reached out to Capitol Hill, I realized that, at the federal level, we're so used to talking about transit in terms of capital building, new transit, replacement of buses, things like that. They weren't thinking about the operating needs. And so we worked with a bunch of transit advocates across the country and transit providers across the country. And really in an incredibly short period of time, we all working together did something rather unprecedented in coming up with money, $25 billion in operating assistance for transit. Which just simply couldn't have been done without a national network of people working together. The research efforts of Transit Center that put together really good numbers about what transit systems would need. It is still not even close to enough, but seeing everyone come together in that effort to ensure that we were preventing transit agencies from basically closing their doors at a time where we needed them most. Was an incredible effort and success. And I don't think I've ever experienced 2.5 weeks of such hard work ending in such success in my entire career.
And it's remarkable to move so much funding in such a short time. And Beth, have you seen attitudes among some of the lawmakers change in response to this crisis?
Yeah, and it was interesting. At first, they simply were not thinking about these impacts. It had not occurred to them at all. They were thinking, we will get to a stimulus bill. We will do just what we did in the Recovery Act in 2009. We'll pour money into building new things. And we were frustrated at first because how can we think about building new things when we can't keep the existing things open? But as soon as we made the point, they got it immediately. And after, I've been working in this field for over 20 years. And, when we talk about operating support from the federal government, particularly to large city transit, that has just been a very red line, a strict border. The feds don't cross that line. That is on the locals. And I did not hear anybody in the House and the Senate from rural, from urban, Republican or Democrat push back like that. We got $20 billion in the Senate bill. And with the real leadership from Mississippi Senator Roger Wicker, we got $25 billion in the House with the leadership of folks like Peter DeFazio, and they negotiated up. It was an extraordinary show of support and an understanding of the public service that transit is that I have not seen at the federal level before.
You were telling us earlier offline that even some traditional transit skeptics among the legislative branch have come around to the right side of this issue, huh?
I don't know if they've totally come around, but in this circumstance, they have recognized that it just doesn't do you a lot of good that you can drive yourself to the hospital if there aren't people there to treat you. And
Yeah.
so you can consider it somebody else's problem that they're transit dependent, but right now we're all transit dependent because it just doesn't help to get to the hospital and not have care.
Our cities are pretty much surviving because of transit, in my view. I want to welcome Ron Burke. Ron, I'm glad that you overcame the technical issues. So glad, we're so honored to have you here. I hope that you can hear me okay. And we had finished introductions, and we were just discussing now first about the current crisis, how it's affecting our business or our part of the space, and then also how we're responding to that. And if I can put you on the spot, because you're coming in midway, I'd love to just get your perspective from Lyft, or more broadly. How has this pandemic impacted your business, your part of the space?
Hey, well, that's a really good question. At Lyft, we've been working really hard to provide good transportation options for people who are essential workers, who are critical healthcare workers, for example, who need to get to work and really treat the people who are being impacted by this devastating crisis around the country. In our markets, we've been, for example, offering free 30-day memberships to healthcare workers and other critical workers through our bike share and scooter share systems. And that's actually been really popular. We all know that transit is the backbone of a good urban transportation system, and Beth and others have addressed that already. At the same time, some of our critical workers have been reluctant to use transit to get to and from work during these times. And so we found that a number of them are taking advantage of this opportunity to ride bikes and scooters to and from the hospital, the clinic, wherever they're happening, wherever they're treating patients. And we've been really excited to offer that program. On the rideshare side, we've also been working with some nonprofits to help critical workers and grocery store workers and a lot of other folks who are impacted by this crisis get around in ways that might not be available to them otherwise. So it's clearly been a hit on our business. I mean, obviously our ridership is down across the board. That's no surprise. But at the same time, we're working very hard to partner with our city partners, especially in our major bike share markets, to continue to provide these services for people who do need to travel and who are allowed to travel during these stay-at-home orders. And I guess we'll see what happens as some of these stay-at-home orders are revised to gradually allow folks to get back. It's also interesting to see that in some of our bike and scooter markets, ridership has stayed relatively strong, despite these stay-at-home requests, and we think that's perhaps some more recreational riding. We've anecdotally, I think we're seeing more people cycling and hopefully doing so at a safe distance. And some of the data we're seeing from our bike share markets perhaps backs that up. That the notion up that people are recreationally cycling a little more than they might have otherwise. I've had anecdotally a number of people tell me, I love biking now at a safe distance, in part because there aren't as many cars on the street. And so that's been perhaps a silver lining here. We also know that speeding has become more of a problem in some ways, with less cars on the street and some vehicles choosing to go fast because they can, faster than they should perhaps. But on the whole, it's been a tumultuous time for, I think, all of us across the country, a difficult time for businesses, nonprofits, healthcare providers, you name it. But we have been, I think, encouraged by the partnerships we're forming with our cities, working with the DOTs, working with local healthcare providers to ensure that critical workers can get where they need to go during these difficult times. And we're really happy at Lyft to be a part of making sure that's happening.
I really appreciate your optimism, Ron, and really showing how Lyft is really trying to be part of the solution here as a collaborator. But you also mentioned it's tough for all of us, and I just wanted to give you some space to just acknowledge the pain. You know, I think there's real pain here. The ridership is down. People are not traveling as much in cities. It's got to be tough for any mobility operator, but especially one in growth mode, you know? Is that
Yeah,
the case?
no, it has been. But at the same time, you know, we feel confident that, we're providing a good service at a time when people really need it. Obviously, ridership is down, but there are still people who really need to get where they're going for the reasons we discussed. And then secondly, you know, we will emerge from this over time, and people will travel again. And I think, you know, for cities to be truly resilient, you know, they need to have a variety of travel options, right? And I think, you know, this crisis, as bad as it is, you know, one of the silver linings is that it really does demonstrate the importance of micromobility. For example, to make cities resilient, it demonstrates the need to really commit to these modes over time, so that we can withstand these types of crises when they come up, and hopefully they won't again. But truly resilient cities aren't overly dependent on cars, aren't overly dependent on personal car ownership, and make it possible for people to get around with a variety of modes. And so we're hoping that some of the changes we see playing out now in cities during this difficult time, like more cycling, at least amongst some people who maybe don't get out otherwise or typically don't ride a bike, some of the street closures, you know, some of these things could stick around and continue to make micromobility a stronger option, and continue to make cities, we think, more resilient as a result.
Yeah. Jeff, just still, I want to shift back to still focused on the here and now, this crisis and how we're responding. I think we all in our audience would really value understanding from you the realities of how your team, your agency has been responding to this crisis. Because in our previous discussions, I frankly was quite impressed to learn just how much you all are doing. I would love for you to share.
There's lots to cover. We've been busy.
Go for it, yeah.
So our first priority was obviously protecting the health and safety of our workforce, particularly looking at what was happening in New York, where over 40 New York MTA workers, mostly bus operators, have died as a result of COVID. We saw what was happening, and that was the first thing that we did was, well, shut down the cable car and our historic streetcars behind me, because our workers were most vulnerable in those vehicles. The city stepped in with a whole array of programs in order to protect our vulnerable workers. But one of the things that meant was that an increasing number of our frontline workers were going out on COVID-related leave because they were members of vulnerable population groups. So very quickly, we saw the trend line for the amount of service we were going to be able to deliver. And when we got the attendance trajectory on Friday, what was this, I don't know, 3 weeks ago now, who knows? Like every week is about 18 months these days. We got the data on a Friday. I got the call, the entire transit team, and I went into the office and spent the entire weekend completely rebuilding the entire transit system over the weekend to accommodate a 40% reduction in critical frontline workers. And that meant that we needed to make some really difficult choices. And among those choices were eliminating the rail service entirely, shutting down all of our subway system so that we can reallocate cleaning crews from our rail yards and from our giant empty stations to our more critical facilities. It also meant shifting entirely to bus, which is by far the most resilient form of transportation. We could reallocate the bus service real time. And then most importantly, it meant rather than providing crap service on 78 different transit lines, we simply eliminated 3/4 of our transit lines to be able to throw all of our resources at the lines that had the highest ridership, because we had very, very good data about how the ridership patterns had changed post-COVID. Make sure that we were serving hospitals and other critical institutions, serving the neighborhood commercial districts where people where the markets and the pharmacies were for essential trips. And then looking very carefully at using our equity strategy to make sure that the parts of the city that had the fewest choices didn't suffer the most by stripping out 3/4 of our muni lines. So that work was done over a weekend. We finished the work on Monday. We built schedules, implemented phase 1 on Tuesday, and completed the work on Wednesday. That is 2 years worth of work that we did in 4 days. And it's amazing, but it also created some unexpected opportunities for us as well. One was abandoning schedules. When your workforce is not showing up reliably because people get sniffles and we tell them to stay home, we couldn't keep a schedule. So we turned on a technology that we'd had for 3 years called Headway Management. And instead of asking the operators to arrive at certain specific points at certain specific times, our operators are now all directed to keep themselves evenly spaced between the bus in front of them and the bus behind them. It's working really well. We rebuilt all of the schedules in order to make operators have a little bit more predictability in their lives, because we knew they're also juggling elder care and particularly childcare with all the schools shut down. And we've been continuing to refine those procedures every day. And now we're in the very fortunate position where our workforce is stabilizing and we're making decisions about what lines to bring back. And I don't think we're going to bring the system back exactly as it was in February. This is a once in a lifetime opportunity to question all of the historic and political decisions that created the transit system in the form that it was, where we inherited it. So now we've got fantastic data, and we're going to use, our values of today in order to decide how we bring the system back. We're also, San Francisco, the San Francisco MTA is both the transit operator as well as the municipal DOT. So we're actually paying a little bit of catch up with other cities in terms of developing our slow streets program. Our health directive was one of the strongest in the country, which meant that we could not do construction work until last week. And now we're implementing a citywide slow streets program. It started off a little rough, since of course we did no community engagement. We were just like, all right, here are streets. That created some kerfuffles that we're recovering from, but of course it's been wildly popular. In fact, that's the greatest risk of our slow streets program, is its wild popularity, particularly our efforts to finally close Street Single Gate Park to cars, as well as the Great Highway, like 3 miles of a major highway running on the whole west side of the city. We just closed the gates. And now we're filling in the network to try to connect all neighborhoods. And of course, watching what is happening in the East Asian cities with traffic congestion coming back as soon as you turn the economy back on, we know the necessity of making it possible for people to use the most space-efficient modes of transportation, because if everyone retreats in a fear-based way to the car, the economic recovery of cities like San Francisco will be impossible. The math of mobility doesn't work if people are taking up 10 times as much space to travel by car as opposed to taking the bus or walking or biking or using scooters or whatever else. So that's the very brief summary of a lot of work.
Yeah, it's so impressive how much you've done in such a short time. And I was planning to hold, a whole period for Q&A from our audience near the end, but there's a few quick ones here I think might be relevant. Was there political pushback for that plan, Jeff, that you all implemented so quickly? How has ridership responded, especially for people who depend on reliable service? And are you still providing night service?
So we're still operating 24/7. We debated heavily whether we would shut down the overnight service. I actually insisted that staff go out and ride the night buses and talk to people to find out what was going on. And they came back very clear that, oh yeah, the people who ride the overnight buses are shift workers who work in housekeeping at the hospital. They're security guards at, office buildings. They are absolutely essential workers and some of the most vulnerable of our essential workers. So that created a very clear conclusion about keeping all the overnight service. Our ridership it's quite interesting. So the entire financial district is shut down. So affluent, white collar office workers can telecommute. Dishwashers, anyone in food, anyone in retail, anyone working in the medical institutions, they cannot telecommute. And so the ridership patterns have changed dramatically, and they're oriented around the neighborhood commercial districts and the big institutions. So we're fortunate to have that data. We've been really struggling to maintain social distance on our buses because so many of the neighborhood routes are so crowded. And so one of the conclusions is we partner with cities like Taipei, who's been probably the city that's been most relevant for me as I think about how do we get transit to recover in a substantial way. We need to start planning for mandatory and enforced facial covering as a condition of entry for public transit, and in exchange for eliminating the social distance requirements, which are impossible to maintain on transit. We also need to do regular temperature checking of not only our workforce, but also riders. And we need to continue to maintain our phenomenal cleaning program. So we clean every vehicle 4 times a day, and all of the surfaces, every few hours, which is taking a huge toll on our workforce. So we need to resolve how do we have a sustainable cleaning regimen. But the big issue here in the United States is the availability of personal protective equipment and making that mandatory, which is going to be a challenge.
Yeah. And you've moved us into the next part of our discussion, which is a very nice segue. Moving from the current crisis, let's talk now about the recovery period and what that looks like. And when I talk about recovery period, I'm referring to potentially a very attenuated period that evolves continually over time, that may start actually now, this week or in the coming weeks, but continues to change for weeks, months, if not the next year or more. And I'd love to get all of your take to start. As we move into this, let's call it post-lockdown recovery period, what modes of travel or business models do you think are likely to see increases or decreases versus normal pre-COVID times?
I'm happy to start if you like. I think there's a common belief and almost a universal acknowledgement that it's going to take time for people to feel comfortable on public transportation again. Just the simple fact of being close to other people is going to make a lot of individuals uneasy, and there's some real safety issues and health issues at play too. The question is, where are people going to go if they still have to travel? Because most people a lot of people can't telecommute, and a lot of trips are not commuting trips anyway. So to me, when I think about what gets me actually to be optimistic for a moment, there's a lot of evidence of really across the Western world, a huge increase in bicycle purchases, individual personal bike purchases. I just saw a friend of mine on Twitter saying now, like, look, I just sold my bike on Craigslist for twice what I ever thought I could get for it. You have a bike sitting in your garage, go sell it. There's bike stores in New York City that have talked about how they're selling way more entry-level bikes than they ever had in previous springs. So it looks like people are taking advantage of the less crowded streets and the fact you can have more distance by maybe fixing up their old bike or buying a new one, a starter bike, if you will. And if those people keep using those sorts of devices, then we actually have some pretty interesting sort of trends in mobility that we could be excited about. And that, I think, it sort of underscores the importance of the open streets movements that you're seeing in a lot of cities, both abroad in the US. And what I hope is that American city leaders will follow the direction that others have in places like Milan and even in Tirana, Albania, and in New Zealand, and say, look, we're not just going to change how we think about sidewalks and bike lanes for the immediate lockdown period, but we're actually going to expand space going forward. Because I think this could be a huge moment to see more people using owned micromobility than we'd seen before.
I'd also add that we need to have going back to normal. We do talk about in the press and in a lot of our conversations about, what's going to happen when we go back to normal, but we're not going back to normal. As the economy reopens, I can't go back to work. There will be no summer camps for my kids. Businesses can open all they want. There's a whole lot of parents in this country that will have no childcare, end of story, until the new school year. So what does that mean? We're going to be in an economic downturn for a while, unfortunately. That is not associated with more travel. That's associated with less travel. So we are likely to have less travel on all modes, period. Partially because the economy will be down, but partially because a lot of us, in my household, not only do I have the childcare challenge, and my husband can't take over for me because he works in a secure facility, which is a very DC problem, but I'm also immunocompromised. So I'm not going to be jumping into a lot of these things. And so there's just going to be a totally new set of needs. And we should think about that and not just go back to our old way of thinking. It is wholly inappropriate, and it's going to be wholly inappropriate for a while. That's somewhat freeing, though. So if a lot of people are turning to micromobility, whether it's owned or it's shared, we need to figure out a way to make it safe for people to travel that way, which we have not made a priority in our transportation program, for 70 years. So let's look at temporary things that we can do to make it easier. Let's look at ways for people to get to work, maybe to allow work to be closer to them. There's going to have to be a whole lot that's well beyond just the typical transportation. And maybe when we talk about transit, we can get away from the unspoken notion that the only way transit is justified is if everybody is packed onto a bus or a train like a bunch of sardines. Maybe we should be running basically empty buses, and that will give people the confidence to come back. But that means we need to provide funding to transit operators to operate mostly empty buses, which has been the first line of attack on transit since I started working in the transportation field. It's really a total shift in our mindset in terms of how to accommodate what people need.
And I want to acknowledge there was a shout out from our audience that childcare is essential for helping many of us get to work in this unique time, if not always. Ron, you work for a company that provides a variety of modes. I'd love to hear your thoughts on my question. What modes do you expect will see a bump up or a decline in this extended recovery period?
Sure, yeah. Well, I think Beth's right. It's obviously going to be a gradual, we'll see a gradual increase in travel across all modes. It's going to take some time for levels to get back to where they were. And to Beth's point, what's the new normal, or what's the future hold? We don't really know for sure, but certainly we expect travel to continue to gradually increase over time. I do think that there's real opportunities for mode shift, as we've already discussed, towards micromobility. For sure, I think transit, if we can innovate in that space, has obviously the ability to continue to be the critical part of our urban transportation network that it needs to be. But I like Beth's ideas and thinking there about how we can innovate in the micromobility space, and that's where I work at Lyft, where I focus my time on the policy team. We definitely are optimistic about that space growing and mode shift towards bikes and scooters and other types of micromobility. I'll give you an example. I mean, we probably all know somebody at this point that right before the stay-at-home orders hit, people who became bike commuters all of a sudden before they couldn't go into their office. I know lots of people anecdotally, but we also saw in some of our bike share markets a real uptick compared to the previous year in bike share ridership. When the COVID concerns had hit, but before the stay-at-home orders had taken effect. And so that's an example, I think, of growing interest in cycling. David Arney spoke to this, and I think he's right, whether it's people owning bikes, using shared bikes, shared scooters. I do think that there's real opportunity there for growth, and we're excited about that.
Great. On the same topic of the recovery period, I wonder, what can we learn from other cities? You already have mentioned some. I think, Jeff, you mentioned Taipei. David, you mentioned Milan, Tirana. Beth, you mentioned how you're trying to help us learn from others' experience. Can you tell us a bit more specifically, what are those lessons that you're seeing that we can draw upon?
Sure. And we do have a lot of great examples right here in the US. I mean, Jeff mentioned some things going on in San Francisco, but right across the bridge in Oakland, they've closed over 70 miles of roadway to traffic to make more space for people. And they are far from alone. In fact, my partners at the National Complete Streets Coalition is tracking this on a map, all the different partnerships going on with ride-hailing and micromobility companies, open streets efforts, and many other techniques, including just curb management changes. We're seeing people take away parking to make more space for drop-off and pickup so that restaurants can stay in business and deliver their products to people who can't go to those restaurants anymore. But in terms of open streets, you've got Burlington, Vermont, who has redesigned or closed 23% of its roadways to traffic, or redesigned it to make more space for people. You've got Louisville, Kentucky, that's closed about a dozen miles to traffic. You've got Memphis, Tennessee. You've got Denver, Colorado, Minneapolis, Minnesota. I know I'm missing some. There are so many cities doing really exciting things in this area. And frankly, they are being strategic. They are looking at some of these cities for permanent change. And one thing that's really exciting about what they're doing is they're doing a temporary change, and they're taking feedback from the public about what works and what doesn't work, which is a much better way of outreach than giving them a diagram or a picture or sketch and asking them to tell the city how it's going to impact their lives. Now they get to interact with it, see what they like and what they don't like, and it makes the case for a more permanent change much easier.
Yeah, and if I could, I would say, this is something, again, that I think Jeff alluded to earlier. We have the advantage in the United States of sort of, if you can call it an advantage, of watching other countries go through this first. And I think we can be a bit insular as a country, particularly with transportation work, I think. And one of the upsides, I think, of the last couple of months is I've seen transit agency and city DOT leaders from small cities and big cities look abroad for ideas, which has been really inspiring to see. And just to give some lessons perhaps from China, not Taiwan, but mainland China, which has largely gone through the worst of the pandemic by now. At least that's the best information we have. It really underscores the importance of the sorts of open streets moves or slow streets moves that Beth was talking about. Because when you look at what's happening in China, first of all, car sales are way up. Wuhan dealerships were reporting record sales in the days after the lockdowns were lifted. I just saw some information a few days ago looking at traffic in Chinese cities in the first week of April. So that's basically as the country is emerging from the lockdowns. And in 2/3 of cities, traffic in the morning rush hour is already at 90% of the level it was the year before. And I think this is important, you already have some major Chinese cities that have more traffic in early April than they did before. So you're up on net. The teleworking is not, at least there, leading to a decline in traffic. These are cities that we know, like Guangzhou, Xi'an, Shenzhen, huge cities where traffic is up year over year at a time when transit ridership is not. The best data I've seen is that it's around 60% of what it normally would be, if that, and there's a big range. Beijing is far below that. And now, if there's a silver lining what's happening in China, I want to focus on China just because I think it's so important, has so many different lessons for us. There is a silver lining that, and as Ron was saying, there is potential for shared micromobility usage to go up. To me, that's more of a question mark compared to owned micromobility. I wrote an article in City Lab
a few weeks ago with Marlo Westervelt about what will happen with shared micromobility. I think it's a big question. We may need to think about regulations in a new way in the United States about how we think about shared micromobility. But in China, you see shared bikes go up in ridership, at least compared to a few months ago, if not year over year. And there's some interesting approaches taken. In Hangzhou, there's a city-managed bike share system there where people are worried about when the bike was last cleaned. You can actually use your app like you would for Divvy or City Bike or Capital Bike Share and be able to see when each station was cleaned and even often when each bike was last cleaned. And I wonder if that's the kind of innovation that may end up taking root over here as well. So and the last point I'll make is just, I think now more than ever, it's so important for people who are going to be at a conference like this or in leadership roles in transit or at city DOTs to share these types of best practices and ideas from abroad and domestic as well. I know there's a lot of conversations happening offline. Jeff, I know, has been in great conversations with Taipei. This is actually how I use Twitter. I think there's a lot of interesting information being shared in that way. And I would encourage people to do the same. We need it now more than ever.
Jeff, under this crush of urgent needs, have you been able to make time and space, as David is suggesting, to reach out to other cities, learn what's happening, share experience?
Yeah, we have to. And we've been following what's happening in other cities from the very beginning. The timeline of COVID follows a very, very precise schedule. And so it hit Seattle a few days before it hit us. So we were seeing what was happening in Seattle. But right now, it's the East Asian democracies that I think offer the greatest lessons about what really needs to be done in order to make the big systems work. So Seoul, Taipei, to a certain degree, Singapore has different authorities, like a different management authority than I think is relevant in the United States, but Taipei and Seoul for sure. And in the transit ridership in Taipei is up to 80% of normal already, which is an extraordinary success and a result of a lot of sophisticated planning. So we had a conference call just at the end of last week with the whole mobility team in Taipei. They've been super generous with their time.
Fantastic. We've started to move already into the third part of the discussion here. We went from the current crisis to recovery. I'd like to talk more about what building longer-term resilience looks like. And is there an opportunity here? Can we build a new normal that's better than the old ways of doing things? Clearly, there's huge challenges here. Can we somehow turn some of these challenges in a positive way and get some positive benefits from it? So I see some thinking and positive thinking. Tell us, yeah, Beth, go for it.
Sure, absolutely we can. I think David points out some great lessons that we can learn from other communities who are reopening, but they're gonna run into challenges with that, and we can learn from them. I think one thing that's happened with COVID-19 is it's shined a spotlight on problems that frankly have always existed. We've always needed transit for our nurses and technicians and cleaning people to get to the hospitals. We just didn't notice it until it was a major emergency. We've always needed our grocery workers to get to the grocery and stock the shelves and help move our products where we needed them to go. We just didn't really care until we really needed that toilet paper. So I think that we have an opening now to have conversations that we were unable to have before because it was all kind of below the surface. And that has enormous opportunity to reform a transportation program, our national transportation program, which you can charitably say was invented in 1982, but you might argue was really invented in the 50s. And there's really nothing that we were trying to address in the the early 80s that remains perfectly relevant to today. But also, I really am excited about the innovations that cities are doing. I really think it's giving them much better information about what is possible, rather than only doing something once you've studied it for a year and done a ton of engineering and making something big and permanent. Doing something temporary and trying it out and gathering data and getting legitimate, strong input from the public who now can touch and feel and interact with it. This should be standard. We should be doing this across the board all the time. Using better data and technology, which we've been forced to do through this, as a more standard practice. Questioning our old assumptions, seeing where they fail in this environment, and updating procedures. There's infinite possibility, and I think we're already seeing that from a lot of leaders across the country.
I really agree with what Beth is saying. One of the things that this has exposed is the way our regulatory regimes and planning conventions and standard operating procedures are really all about protecting the privileges of the establishment and stopping change. Something that the emergency orders have done is unleashed the ability of government to actually solve problems. So we're getting stuff done in part because we've been allowed to. The other thing that the emergency orders have done is forced us to be really, really clear about what our values are. So government historically doesn't do a particularly good job of being able to articulate values, and particularly to articulate the trade-offs that we have to face. How do we allocate our very limited resources in order to best achieve the public good? This experience has forced us to get really, really clear about what the public good is that we're trying to serve, and has demonstrated that government is capable of getting a huge amount of shit done if we're clear about what we're trying to achieve and if the rules aren't getting in our way. And so my hope coming out of this crisis is that it changes the culture of my agency, that my staff are clear about that, like, we can actually get good work done, but only if we break down stupid, pointless silos, only if we rewrite the rules that get in our way and that promote inequity, and only if we change our approach to communication to focus not on maintaining some false hierarchy, but on getting the work done.
I'll offer a thought, if I could, about this idea of building in resilience. I think given who goes to SUMC events, I'm sure there's a lot of people who are in the audience who are fans of mobility as a service, or MOS. And I wonder if this is actually a moment as we come out of the pandemic, or just sort of adjust to the current situation, where MOS suddenly becomes a whole lot more important. And the reason why I think about that is that we're creatures of habit. We shop in the same places, we go to the same places, we travel in the same ways to the same places most of the time. But then every now and then there's a shock, and there's a lot of evidence into this. What drives mode shift? It's often having a new job, having a child, that leads people to change how they travel. Well, the entire Western world is going through a shock right now. And a lot of people are going to be, when they do start traveling again, some of them already are, thinking about, like, how, in a city, how do I want to, if I used to take public transit, maybe I want to look at other ways of getting around. And for a lot of people, if they can afford to have a car, the default is going to be to drive, which is not a sustainable option for all the reasons we all know. And I think part of the challenge that this is both the public sector and a private sector mobility challenge to me, is how do we actually make it easier for people to, when they're thinking through, okay, how am I going to travel? Don't default to the car. If you do take transit when you can, if you can't, then let's make sure that there are options for the route, for going to the place you want to reach, whether it's by personally owned micromobility, or shared, or walking, or whatever it might be, just to travel in a different way than you might have gone in the past to that particular place. There's a technological element of that, which is these MOS platforms that get a lot of attention, which I've traditionally had some skepticism about, I've written about, but now they may really matter. But there's also, I think, the importance of building the infrastructure that makes people comfortable making those sorts of trips to go a couple miles on a scooter or a bike, as opposed to feeling like they have to drive, which again reinforces all the importance after the lockdowns end of maintaining the space for people to be able to move around by walking, biking, using a scooter, what have you. So for those of you who care about MOS, and some of you probably work within MOS, this may be a really important few months ahead of us where you can contribute.
Yeah, this is yeah. If I could just real quickly, Clayton, yeah, thanks. Just to add on to what David is saying, and just wearing my micromobility hat at Lyft, I think I am hoping that this low traffic environment creates some real opportunities to lock in the kind of street design changes we'd all like to see, or at least a lot of us on this webinar would, to make it easier to use micromobility and safer and more accessible to everyone throughout a city. This is a really unique opportunity to do that. And as Beth mentioned, some cities are taking advantage of this already through open streets and so forth, putting in some new temporary bike lanes that might become permanent. So we're really optimistic that some of those changes will stay in place, number one. Number two, I'm hoping that the importance of micromobility is even more obvious now. For some city officials, and I'm not all, but for some, it's seen as extraneous, like, take it or leave it. We'll let the private companies pay for it, but we're not going to support it otherwise. And I think, we're seeing that that's not a winning formula, for cities to be resilient in the long run. Ultimately, whether it's stimulus funds or federal transportation dollars, that kind of support can help make, that kind of funding, I should say, can help make micromobility really thrive and reach its full potential in cities, in partnership with private companies like Lyft. So we're excited about that. The biggest challenge I see, kind of to what David was referencing, I hope we're not going to go from placemaking to space making in a long-term way. We need to continue to really value those types of public spaces, value the economies of scale that come with public transportation and so forth. And we know that we have new challenges in that space, but ultimately, as David said, if we're all just driving around in cars, our personal cars alone, that's not sustainable.
So Ron, you're optimistic that some of these changes to this physical street may become permanent.
Yeah.
Beth, you've highlighted quite a few examples. Jeff, what about the San Francisco area? Is the idea here to go back to the way things were? Is there some hope to make some of these slow streets permanent?
Yeah, there's a lot of hope to make the slow streets permanent, only we have no money. So right now, both Oakland and San Francisco, we've taken our construction barricades and thrown them up randomly. They have to keep being replaced weekly. In order to make real infrastructure, we need actual capital dollars, and we need to be able to sustain our construction staffs through our operating budget. And that's going to be a challenge given the intensity of our financial losses.
I want to move into some of our audience questions, and some of them are already very appropriate for this part of our discussion. I'll just acknowledge that one participant highlighted that some of the big issues like climate change remain really important. And if we care about climate, we care about creating a successful economy with decreased or changed mobility patterns. How do we do that? I think that you already have answered much of that. I just wanted to highlight that as a key question that our audience is thinking about. You've highlighted that through micromobility platforms, changing public space, funding, and so on. But I did want to highlight that. But also on this the same topic of how things could change to be a better new normal, a really interesting question here. Do you see this crisis presenting an opportunity to change our planning approach from 5 to 10-year planning horizons to more direct and responsive plans and initiatives, perhaps using real-time or rich data to inform the very next things that you as a company or transit agency do? Does this reset allow for that type of change?
I mean, it certainly does allow for it. Whether or not we will take it is a question. I mean, we seem to be highly resistant to learning anything in transportation in this country. I was just looking at statistics from states on traffic counts, which they're using to measure what's going on in the economy. It's a good measure. When people aren't traveling, it's generally a sign of problem, of lack of commerce. But typically in the transportation field, the way we measure the economic impacts of investments is whether or not people can drive at high speed, which they can do great now because there's nobody out. So the economy's booming, right? No, maybe this gives us a chance to tell the DOTs to stop using that measure then, because it's a terrible, terrible measure of economic success. While there are some minor benefits to saving people time by speeding up travel, the value they put on it is questionable because most people don't want to pay tolls. so for faster speeds, which tells you they'd rather spend the time to spend their money. And our wide open streets full of people not traveling is not a sign of a good economy. So yes, we can highlight that, but that's kind of on us who care about these things to point it out, to use this odd time to say, you know, normally we view what's going on as X, Y, and Z, and this is why it's foolish and we need to grow up. But it's really going to take some aggressive tactics to point this out. Frankly, Congress is very comfortable, and I think a lot of state DOTs are also quite comfortable in an environment where they are just allowed to do business as usual. This is an area that has allowed Democrats and Republicans to gather together and cut ribbons and not have a fight on something. Never mind that they have bipartisanly come together to undermine both of their priorities equally. We've not had a conversation about what we should be achieving, whether it's climate or equity. I think that this is a chance to force that conversation. But let me just say that in talking with folks on Capitol Hill and looking at a stimulus opportunity here, they are looking at doing nothing differently than they did in 2009, which we've already shown was not very effective at getting projects to ground quickly, spending the money on the jobs that create the jobs the fastest, or updating our procedures so that we have a better impact on providing people access to jobs and services, whether they can drive or not, improving the efficiency of the system so we're not polluting as much as we need to be, and any number of other issues. So yes, huge opportunity, but recognize that we cannot expect other people to see this opportunity. We are going to have to, you know, strap them down in their seats and play the movie for them to make sure they see it.
Yeah, I would fully agree with what Beth said. And we'll add on the private mobility side, like the private scooters, bike share, ride hail, all offer extraordinarily positive opportunities. And yet in this crisis, none of them have come through as useful partners, at least in my city. 3 of our 4 scooter operators just closed up shop. Our bike share provider sued us to maintain a monopoly and has forced the shutdown of their competitive bike share operator. I am in a big fight over getting basic data from our ride-hail companies in order to actually be able to manage the system and direct resources where they're needed. At a time when all of these private companies should be demonstrating their value, they're actually fighting for their own financial lives and therefore prioritizing the convenience of the privileged over the needs of cities and their more vulnerable travelers. So the private mobility space has got a lot of work to do to rebuild relationships with cities and see that and get people to see them as actually a part of a solution rather than just a mechanism for some potential profit in the future.
Ron, I want to get to you because your name has been implicitly invoked here as part of Lyft. But David, you've also been emoting a lot about Beth's and Jeff's comments. Did you have some thoughts you wanted to share?
I'll just be brief because I too want to hear what Ron thinks. With regards to, no, it's just interesting hearing Jeff's thoughts on the private shared micromobility in San Francisco. I guess I'd make a couple points. One is San Francisco is unique in the United States in that Jeff has a lot of power, a lot more power than most transit agencies or city officials in the rest of the country. For a variety of reasons in the United States, we've sort of separated transit management from street management, and sometimes for-hire vehicles is totally separate as well. And I think that now, a moment like now is actually a time when we realize it doesn't totally work well, because we really do, if you think about like the regional well-being of the Bay Area or New York or Washington or even a specific city, it really requires making trade-offs of various modes. Again, with this shared goal that I think almost everybody here feels of not nudging everybody to drive for himself or herself for all the reasons that we know. And it's very hard to make those kinds of trade-offs when you have this sort of balkanized management of local transportation. So it makes me realize, like I'm glad to hear, Jeff make those points about about the challenges of working with shared micromobility. I actually have not heard that from other transit officials in the US, largely because they aren't even involved. And I wish they were, because there are some trade-offs there. Maybe there's a way of in Pittsburgh, the DOT director there has talked about maybe being able to support expanding some capacity with the transit agency, which of course has much less capacity than before, by offering some shared scooters to essential workers that they can have for a few months. So there's a way to travel apart from buses. That's so unusual for a city DOT leader to think that way, in my view, that I hope we can actually bring, maybe this is another moment to remember that we're gonna have, in my view, better cities in the short term, medium term, and longer term if our city mobility networks are managed in a way that enable us to make trade-offs. So I've punted on Jeff's actual point about whether it's good or bad what the shared micromobility providers are doing. So I'll hand that one over to Ron. I'm curious what his thoughts are on that.
Yeah, so Ron, there was some critique there. What's your thought on that?
Well, as I mentioned earlier, we're working really hard with our city partners around the country to offer programs during this difficult time. I mean, obviously, there are financial pressures across the board, whether you're running a transit agency or, Lyft or any other company in this space. But, I'm really proud of the work that we've done in the cities, for example, where I spend most of my time, for example, in Chicago. We have hundreds of people that have taken advantage of our free memberships for healthcare workers and other critical workers to ride Divvy Bike Share. We've had very similar experiences in New York and Boston and other cities where we operate bike shares. So we're working hard to be good partners in this really challenging time, and we're going to continue to do that.
All right. I would like to ensure that we're able to field a number of questions, which we have been doing on a rolling basis from our audience. But since I'm not able to assimilate all of them at the same time that I listen to you well, I'm just going to read through maybe a batch of questions and ask you, as appropriate, to field one or two that you feel are most relevant for you as panelists. So in no particular order here, there's a question about explaining the empty buses strategy. So I did recall there's a question here, how will transit operators be able to operate well in an era of reduced fare revenues while you're trying to actually implement a system where you're trying to ensure social distance aboard buses? Beth had mentioned the issue of funding for a bit. That is a question from our audience. It sounds like private mobility platforms are looking to partner with public entities as a way forward. What opportunities does that open for public agencies to require more or better performance on equity, workforce, and data sharing from private platforms? Very relevant for the end of our discussion. I'm worrying that the speed of reopening is faster than setting out innovative transport plans. How are public and private sectors, what can they do to avoid losing the opportunity to change? All right, and just move on from there. And then there's a few questions just for Jeff here. Jeff, how will you resist the force to revert back to the status quo in the recovery period? How can leadership maintain the energy and political will and opportunity for change when conditions begin to normalize? And I'll just try to find one more in here. Mr. Tumlin also, how will increased levels of congestion on roadways as folks return to work affect your ability to utilize the headway management? Will you return to schedules? So that was a half dozen questions there on a variety of topics. Don't feel the need to answer them all, but where you have some special perspective, we'd love as an audience to hear from you.
Clayton, I think you need to provide us with more direction.
Well, Jeff, your name was invoked twice, so there are two questions for you that I just read. How will increased levels of congestion on roadways as folks return to work affect your ability to utilize the headway management? That's an operational question. There also was a question there. I'm trying to find it. How will you resist the force to revert back to the status quo in the recovery period? How can leadership maintain the energy and political will?
So headway management is great when you have a lack of reliability. So headway management works particularly well in a congestion environment because rather than trying to maintain a specific schedule, you just do the best you can given the conditions. So that's great. But the big part of the work that we're doing right now with our recovery planning is establishing a goal that for the 17 lines that we stripped our system down to, making sure that none of those lines are ever stuck in recurring congestion ever again, because the economic recovery of San Francisco is dependent upon that, the basic limitations of the geometry of mobility. So that's a huge focus. In terms of resisting the forces of stop all change, which are very powerful in San Francisco, it's one of the reasons why we're trying to work so quickly to demonstrate change. People don't believe that government has the capacity to make cities better. All of our rules that we have to follow are established around slowing the pace by which everything gets worse. That's the whole basis of the California Environmental Quality Act and NEPA. It's not to make things better, it's to slow the pace by which things get worse. And so in order to
Jeff, you're suddenly silent to us. I think that we've lost Jeff's audio for some reason there. So, can we hear you now? Oh, you are back now, Jeff. Go ahead.
I'm back. Oh, sorry.
It looked like we were missing something really important. 15 seconds.
The short version is we're resisting the forces of change by just going out there and demonstrating. Just throw it out there and like, look, this is what we need. And then have people discover it and enjoy it and have it be joyful.
Yeah, demonstrate that success. I want to try to focus some of the questions that I drew from the audience later and maybe focus and ask you a question, Beth. There was this question about how we ensure social distancing. You had mentioned this issue earlier, and there's a specific proposal from an audience member who says, is it possible that we could even change the funding model to ensure that transit has the funding it needs? Some, like in Portland or in France, base funding on a benefiters pay tax levy on employers, ones that are more resilient to drops in fare box revenue. Is a change in the funding model like that potentially in the cards?
Well, all of our traditional funding methods are at risk at least in the short to medium term. So yeah, I think all old bets are off. I know that Portland does use an unusual way of funding transit. Indianapolis uses income taxes to fund transit. As a result, they're more able to weather the problems today, but they're going to have funding impacts that last for 2 years. And they're very fearful that they're going to be suffering massive hits to their budget years after the focus is away from this time. Every funding mechanism is good. Every funding mechanism is problematic. The problem has been nationwide, we don't consider transit important. We consider it either something for those who have no other option to use, and we fulfill our service to people who are transit dependent by giving them a transit service that nobody who has any choice would ever deem to use. And that is tragic. I hope that this starts to convert that and we start to put a priority on it. We have a lot of opportunity to raise those very questions about who benefits from transit. I think we now see drivers benefit from transit, not just because it gets people out of their way, but because the people they need to maintain the economy and service jobs and things like that rely on transit. But also it allows us to question old assumptions, like I mentioned before. So Congress has started talking about a stimulus package where they will provide, a fraction of the money for transit that they provide for cars or for highways. because in 1982, we struck a deal to raise the gas tax with urban representatives that provided 80% of the funding to highways and 20% of funding to transit. And that's the last time urban representatives asked for any reform to the transportation program ever again. Maybe in a time where the gas tax wasn't paying for everything before COVID-19, they were paying only about 70% of the cost of the program at the federal level. And now we'll be paying way, way, way less than that. And in a stimulus bill where there will be zero user fees, zero gas taxes, we can question whether or not highways are the right investment, period, right now. And maybe all the money should go to transit, or maybe equal money should go to transit. Let's really start to throw away the old assumptions and question what is needed for recovery. And I would argue what is needed for recovery is investment in existing communities, that's state of repair projects, not expansion projects, and investment in transit services so that the economy keeps running in the way we need it to run through this crisis. And then when we want it to gear back up, everyone can be a participant in that recovery. I remember very clearly when I was in law school and I did not have money to buy a car and couldn't get to any of the jobs available to me because I didn't have a car to reach them, but couldn't earn enough money to buy a car. And I did not grow up poor. It is preposterous that we ever allowed our economy to function in a way where we tell people who can't pay the entrance fee of a car that their work, their labor, and their ingenuity is not welcome in our economy. And we really shouldn't do that going forward. And we have the opportunity to raise all of that now.
You're here. So on that note, I want to reflect on our panel and leave you with the final word before we part. As a last question, just for each of you, if you could take just 20 seconds, no more than that, and just answer one question. If we're thinking forward to a relatively positive scenario emerging from this pandemic, one where we've risen to the challenge as a community the best that we can, we've somehow maintained key mobility assets, we've built resilience, a better future than we had in the past, please highlight who has been a key actor in making that happen. Just one. Who has been a hero in that scenario, and what have they done? Could be lawmakers, could be members of your team, beneficiaries you serve. Who's a hero that makes that positive future happen? I'll let you think about that just for a moment while I do my best in real time to summarize and synthesize everything that you've said in our rich discussion for the past hour plus. I think that we've heard a few really strong themes here. First, a very strong theme of stories of resilience. A story of, first, a feeling of fear that we must acknowledge, of pain that is happening in the public and private sector on both sides, but also some unprecedented moves. For example, $25 billion for transit, changing attitudes among lawmakers that has enabled that to happen. Also redesigning some of our systems. Impressively, we heard that San Francisco Muni redesigned its services over a weekend, implemented that by Tuesday, abandoned schedules. So quite a set of stories about a resilient response as best as possible to the current crisis. Second, I think we've heard a lot of learning that we are doing and wish to do to make the recovery period work as well as possible. We've heard about efforts already to learn from experience of East Asian democracies like Taipei and Seoul. Also to learn from how Milan is changing its use of public space and separating the times at which people are commuting to work, or Tirana, and learning from Guangzhou, Hangzhou, even an app there in Hangzhou to help people learn or just understand whether their bike share has been cleaned recently. And we've also heard about operational solutions, cleaning the buses 4 times a day to make sure that things are going well, and a request, a need during the recovery period for just basic fundamental data from private companies to help ensure that public agencies can prioritize public equity and social good amid this very challenging period as we come back. And then third, I think there's been this theme around building a better new normal, and quite a few really powerful ideas here. There's been an idea first about changing the culture within our own agencies and companies, to be able to get things done, which we already are, to be able to break down silos and break out of the paradigms of how things have been done, to ask why not and how can we simply do things differently. There's also the proposal that MaaS, mobility as a service, could become even more important in the future, and that shocks to the mobility system can enable and drive mode shift over time, where we could potentially, if we get our messaging out to the right people, really help to move the mobility system in a more sustainable direction. Even some of the pilots that we're seeing around street design and street space, we could envision proving the case through successful experience here and perhaps making some of those conversions permanent. We've also heard about similarly trying to shift the whole funding model of transportation and using this as a very relevant and valid case for why we need to fund sustainable mobility better. And we've heard again about the need for data to help make more responsive changes near real time in the mobility system. These are just some of the key ideas we've heard. There have been more than those, but I think these are some really incredibly rich, interesting, relevant ideas that certainly have stood out for me and that I think all of us can take home into our own work and advocacy to really bring these things forward. So now I will leave you, our panelists, with the final word for all of us. Tell us, who is the hero who has made things better into the future and what have they done? And let's start alphabetically. We'll start with Beth.
I would just say, I struggle to identify one person, but I think of public officials like Jeff and like folks at the city level across the country who have not just reacted by kind of shutting down, but rather by being super creative, trying things out and sharing their experiences with others so that we can learn from this and do better going forward.
David?
I'll say Julianne Genter, who is the transport minister for New Zealand. She's actually born in America. She's young to be in the role, but she was the first person I saw in a position of power about 2 weeks ago make an announcement that in that case, I think 100 million New Zealand dollars or 60 million US would be used to expand bike and street space after the lockdowns are lifted. And I think subsequently we've seen a lot of European cities go down that path. Maybe some American cities will too. I certainly hope so. But I tip my hat to her for, I think, being the first leader to make a big splash.
Yeah.
So Clayton, I love you, but your question is ridiculous. What's amazing to me about this particular crisis is the way that everyone has come together, that there's a sort of heroism throughout the agency, you know, at all levels. And if there's any real hero, it's maybe just an idea, the idea of the public good, and that if we're clear what the public good is, the government agencies have the capacity to deliver and to deliver well.
Ron?
I'm going to name two categories. I'll be quick. One is frontline transportation workers whose jobs have become even more difficult and are keeping us rolling. The second are mayors who are willing to implement resilient street strategies that not only provide safe distancing opportunities today, but also make it possible to have more dedicated space for public transportation, biking, walking, and scootering in the future.
Fantastic. Sharon will give us a minute just to tell us about next steps. I want to thank you all so very much for this rich discussion. And in the awkwardness of Zoom, I'm going to applaud for you on behalf of all of us. Thank you so much.
Well, and that's great because I was going to applaud too. There, hear it, because this was an amazing discussion. It was fantastic. I can't seem to put on my video, but I want to just let you, oh, now I can start my video for 1 second. And this was just a really incredible discussion. And I think all of you have kind of summarized it. I mean, it seems we're at this very important moment and there's a lot of opportunity, but there's no question there's a lot of challenges as well. And it's really going to take us all working together. I do want to just give a shout out in terms of Beth and T for America, because that is definitely one place where we can all join together in terms of federal legislation and at least trying to get some of that right. And then, you know, stay tuned for other ways that we will continue to work together.